Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting this week from This Just In Studios on the Healthcare Now radio network, as well as the Business Radio X network. But also, we're broadcasting live on LinkedIn Live because we have a great show today. Phenomenal guests that I'll announce here in a moment, but true public policy experts. I've worked with them for many, many years in Capitol Hill, but looking forward to this show for sure. And also, as I mentioned, multiple guests. Usually I have one guest. Today I have multiple guests. But also on the heels of our announcement last week that we won 2024 Podcast of the Year, we've also expanded our broadcast globally on the Health Podcast Network and the phenomenal community there. So looking very forward to those collaborations and could not be more thrilled as we grow globally. And also I'm excited to announce that the This Just In Radio show will be broadcasting live from the Georgia HIMSS Annual Conference in about 10 days in Atlanta, Georgia on October 1st. So look out for that live broadcast. And then also from the health event in Las Vegas on October 20th to the 23rd. So please join us in Atlanta on October 1st or in Las Vegas on October 20th. But now for this episode, my 306th episode, we have a great show with two of the most connected and coolest policy experts in healthcare and in digital health and on Capitol Hill. Mari Savickis, Vice President, Public Policy for CHIME, and Chelsea Arnone, Director, Federal Affairs for CHIME. Welcome to the show, ladies.
Thank you for having us today, Justin. We appreciate it. And I think we
Absolutely.
are pretty cool, so I'll go with that.
You guys are. First of all, Mari, how long have you been on Capitol Hill? How many years?
I've been in advocacy. Oh gosh. I don't know. I've been in public policy for like 25 years, Justin.
Yeah.
I'm not sure
Yeah.
I've broken it down, but it's a long time.
Same here. Let's go. And you, Chelsea?
Oh, maybe 17-ish, 16, 17, somewhere in there.
It's awesome. Yeah. It's I'd be proud of it. I've been on Capitol Hill since 2004, so I guess 20 years. I don't
When
obviously
we
do as
met,
much as I used to.
Justin.
What's that?
When we met. You and I met.
know. Yeah, 20 years ago. Very, very cool. All right. So, well, first of all, I do want to hear about, and have my audience also, you guys have a good summer. So I'll start off with you, Mari. Would you got anything fun from the summer that you did?
Oh, lots of family stuff. Yeah. I mean, the usual, a lot of beaching, a lot of
And where do you live
seafood
full-time?
consumption. What's that?
Where do you live full time?
I live in Fredericksburg, Virginia, full time, but I'm like 100% mentally at the beach.
Yeah.
Which is
Which
behind
beach
you.
do
I
you go
can
to?
see that, Justin, making
Yeah.
me jealous. I mean,
Yeah,
really?
Sarasota Bay. I
That's
know.
not behind me.
It is great. Which beach do you go to?
We split our time between Virginia Beach on the Bay side and then also up in New England at Rye in New Hampshire.
Sure. I grew up outside of Boston, so I went to Rye and Hampton, Rye, Hampton Beach, all those for quite a bit.
Yeah. And I miss going to Block Island this summer, which was a travesty, but
Yeah,
I'll be back next summer.
love it. What about you, Chelsea?
I spent some time with family in Michigan, very underrated for their beaches and lakes. I'm going to say that, but not everyone flocked to Michigan at once because it's kind of like my safe home space. But I will also be leaving for Italy in T-minus like 12 days or so.
What part of Italy are you going to?
Where my family is from, Calabria, southern Italy. So
That's where my family's from. My grandmother, Lucia Cavalieri, is from Calabria. Yeah,
Get out of here.
seriously. That's so cool.
Such a small world. So I am going and visiting the old country, and I'm thrilled about it.
Awesome. Yeah, my old business partners from Greenway, we went over to about a month ago. We went over to, started off in Venice, then went to Ljubljana, Slovenia, and then on to Vienna. So Venice, Ljubljana, and then Vienna.
I think we're doing like Naples and then Amalfi, and then we're, Sheila, and then Tropea, and then, I'm all about the food and the wine.
Absolutely. Very, very cool. All right. So now let's dive in. For my audience that may not know a lot about CHIME, Mari or Chelsea, give us like, a minute overview of CHIME, what you guys do in the industry, and obviously if you can work in our good friend Russ Brenzel, that'd be awesome as well. So
Sure. CHIME is an executive organization serving CIOs, CISOs, CMIOs, CNIOs, and other senior health IT leaders. And we are led by our CEO, Russ Brenzel, as you mentioned. Yeah. And the public policy team, Mari, myself, and Cassie, small but mighty. We serve as the collective voice for our members here in Washington, D.C., the hospitals and healthcare systems. And we're advocating on their behalf for digital health policies that improve the health and care in communities they serve and the patients they care for.
Awesome.
Made it sound really easy.
And how long have you guys been doing this? I mean, how long has CHIME had, I guess, a policy on? I mean, probably 20 years, right, Mari? Is it?
It predates me, and I've been here 9 years. I think I should know this off the top of my head. It's probably more like 15 or 20. It's a while.
Sharon,
it's definitely evolved quite a bit since I've joined.
Sharon Cantor, was Sharon the one up there? I worked with Sharon exactly a lot 20 years ago. Yeah.
Then you nailed. Yeah, I guess it would be 20 years ago.
Yeah. Yeah. I can't believe I remembered her name. But yeah, I mean, I haven't seen Sharon.
That's impressive.
15 years, 16 years, but she was awesome. Excellent. So let's go ahead and dive in. Obviously cybersecurity, top of mind in healthcare and top priority for most organizations, if not all. What are some of the biggest challenges CIOs and CISOs face today? And then, specifically, how are you guys helping them? How's CHIME helping them address those challenges? So,
do you want me to start, Chelsea?
Yeah, Chelsea.
Yeah, I mean, a lot of what we do actually, Justin, is rooted in digesting incredibly complex policies and just translating them into plain English, breaking it down for the average member, even for the foundation firm. It's, Chelsea's job now is to, and she's going to dive into this, but dig into hundreds of pages of complex regulation. There's bills that you need to root out, which subsection are we talking about here? I mean, literally one little letter can make the difference. One word can make the difference in a statute. And so it's just sort of, and every day there's a fire hose of information that comes out from the federal government that we're just sorting through it every single day and trying to figure out, well, what out of everything that's come out today, what's the most important issue?
Would you add to that, Chelsea?
I disagree wholeheartedly with Mari that they are, but I would add that there are sometimes thousands of pages of regulations. Yeah. It kind of makes your eyes go cross sometimes.
So let's dive into cybersecurity a little bit. What are some of your, what do they look for today? What are you guys specifically working on regarding cybersecurity? And what, is there a best practice or something that we can kind of share with the audience around, what to look forward to or what to seek out with you regarding cybersecurity?
I think CERTIA is a big one that is coming next year. They went through the law passed in 22. And then that's where my job begins. And that's where they issue RFIs, requests for information. And so responding to that on behalf of our members, getting feedback from them, because I only pretend to be a CISO, and, making sure that their voices are really, truly heard in our letters. And then the proposed rule came out in April, May, and they extended the comment period graciously by 30 days. So never going to complain about that, especially when I didn't ask for it. But I was like, that's nice. Thank you, SZA. So we sent in a 34-page comment letter. Mari's like, how long is it going to be? I'm like, as long as it needs to be, Mari. As long as it needs to be. I've got a lot to say. I've had a lot of feedback. So really looking to how they implement that and take our feedback or not and kind of make it a little bit easier on our members. But it's going to affect every single, as proposed, every hospital over 100 beds in every critical access hospital in their cybersecurity and how they report it and the mandatory reporting.
Right.
So September next year is when the final rule will be out.
Okay. And I think it's for my audience, that was basically passed in legislation. Then, like you mentioned, it moves over to the regulatory side. So that's when your world kicks in. I think it's just people understand, they know how Capitol Hill works, but just not to assume everybody knows this. Obviously, when Congress goes through their work, they pass policy signed by the president, and then it moves over to the regulatory side. And specifically, which department? I mean, is this all under HHS, or are you guys working with?
It's under the Department of Homeland Security, Cybersecurity and Infrastructure Security Agency, CISA.
Okay, that's it. Okay, excellent. All right. So, anything else on cybersecurity, or you guys want to move on to our next fun topic of AI?
Well, One thing about you're talking about like how the bill becomes a law. I mean, people are always surprised at how long it takes or it doesn't take. I think that's something that we run into a lot that we have to educate members on. Like they might get word like, oh my gosh, this is going to become like law tomorrow. I'm like, no. That is not how lawmaking works. Or even compliance deadlines. I do think, sadly, sometimes stack up kind of quickly, and there's often maybe a disconnect between what federal authorities think that is realistically accomplishable in the marketplace versus like what is really reality. And so regulatory deadlines can be challenging, but the policymaking process is actually several years long.
Right.
So from the time you pass a law to actually when it gets executed, and sometimes those deadlines get shifted. We're looking at the HIPAA security rule getting reopened. And, I think people hear that and they get nervous, and, change is hard, right? It can be scary, but it's not as if it's going to happen tomorrow that everything would be effective. So it's just a longer tail than I think people expect.
Well, I think I'm glad you brought that up, because that's something in most part, that's a good thing, because we want to make sure everybody's involved, everybody's educated, your voice. And it's one thing I've always said is, they listen to all voices. They really, truly do. You need to make your voice heard. Certainly if you're a member of CHIME, work with you guys to have you bring your voice forward. Capitol Hill absolutely listens to it. So certainly on the regulatory side, follow those paths, always give your opinion, always share your expertise, always share your advice. They read every single word you produce, every single word that you submit, every piece of testimony, feedback, responses, they read it. And that's why sometimes it takes longer.
Even if it doesn't feel that way, right?
Yeah. Yeah.
I noticed it. I'm like, one commenter said, and I'm like, that was me. That was us.
Right, exactly. So, and that's kind of where I always like to kind of motivate people, because they absolutely do read it. I'm very impressed with, Steve Posnack and what that whole team on the ONC has done through the years and years and years, and how deeply they worked with us to try to get policy right at every turn. When they didn't, they would do, administrative corrections or whatever they had to do. It's important. It's an important process. And so, but also it's good that it takes a while, because there's a lot to be said. There's a very complex, as you mentioned, policies, thousands of pages of regulation, thousands of pages of legislation, thousands of pages of regulation that have to be implemented the best way to balance public and private too. You don't want to be so prescriptive. That's also really important, is that the government's not overly prescriptive in what they put, because the industry needs flexibility. However, the industry wants some structure because they can't write ambiguous code. It's ones and zeros. So we got to be, we have a marriage in the middle, and that's something that we always balance through the decades. But I highly recommend everybody let their voice be heard, and certainly their expertise. If they have expertise, if they have experiences, share them, because people want to hear and know, and we leverage that on Capitol Hill. So awesome. Moving along to AI, obviously hot topic. It's going to be a hot topic for many, many years to come. But and there's a lot of potential with AI to revolutionize healthcare. We all know that. But brings up regulatory and ethical concerns. But from your perspective, what are some of the key policy considerations that need to be addressed to ensure AI is implemented responsibility in hospitals and healthcare systems?
There's many. Do you want to start, Chelsea? It's like, wow, where do we start with that?
Yeah,
go ahead.
It's a lot to unpack. I think, just from being at a recent event with HHS and ASTP, formerly known as ONC, it'll take a while to get used to that and just train my brain to say ASTP. I think that I get the impression that they are looking for guardrails, and they want to protect patients. They want to protect our members. They want to not stifle innovation. So they are looking for feedback and looking for our members to share their use cases, whether it's clinical or operational. So there's both sides of the AI fun in healthcare. It's, do you streamline it? Like, that's the easy part, and easier than the clinical part, which is a little bit more, takes a lot more consideration with privacy and ethics and making sure there's still a clinician there. It's not a replacement for clinical judgment. It's like a tool to augment the decision-making.
Anything you want to add to that, Mari?
Yeah, there's a lot. We just put out a set of AI principles. That's what you do in Washington. You put out principles, But we queried our members, and it actually was a lengthy process, just trying to get our arms around, what's their thinking? What are they doing? And it was, it was like the end of 2022 when, a chat was like arriving on the scene, and everyone was kind of like getting all like spun up about this. And so we, really spent 2023 being mindful, like asking, because healthcare, they love innovation, they do, but you don't just jam this into a healthcare system, right?
Right.
And so we talk to a lot of our members, and we have everyone from really small, underserved, all the way to like the large, better funded academic medical centers, integrated delivery centers. And we came away with things that wouldn't actually be that surprising to you, like privacy, right? We still have a national privacy law, right? So there were things that kept coming up, and yes, it's like shiny and new, but you have to treat it just as you would other technology, which is ensuring it's deployed wisely, right? Doesn't increase the digital divide, like things like that. And so
Right.
I don't think it was like terribly surprising, but we tried to be really mindful about it. And these are really tough issues, right? It's not as if like, oh, we're just going to like wave our magic wand. I have one, it's like sitting right over here. I use it on an as needed basis. It's not that easy, right? Ding!
Right.
National privacy law. So it's, these are tough issues.
Yeah. I agree. So no, I've recently been appointed to the Coalition for Health AI, and so Halamka's group, and so it's it's that we're starting to tackle a lot of that from even some similar perspective to what you just brought up. I guess when you look across, inside your principles, like what are one or two key items from your principles that you would want to bring up in this show that you want people to know?
Well, let me pick up on something that Chelsea said, and then I can let her fill in some of the gaps here, is this notion of use cases, right? Most of our members do not have the funding it takes to deploy large language models. It is costly, hundreds of thousands of dollars every month, and the average provider does not have it for reasons I'm sure we'll dig into further into your show. Yeah. So as we are talking to federal authorities, we're saying, well, why don't you look at some of the low-hanging fruit, right? Places where AI can actually make a difference, maybe through administrative savings, right? So things that maybe it's staffing. I mean, Justin, like these are, there's a lot of issues and a lot of challenges in healthcare that can be solved maybe through like more efficiency. And so that's where we're poking around and like, help us help those who aren't like the best resource, try to start to think through how they might deploy some of these, one or two of these use cases. So I don't know if Chelsea, if you want to add into anything else in the principles or pull a thread there.
Yeah, I think that the regulatory uncertainty and potential burden is sort of weighing heavy. Like there, as Mari said, even for the large integrated delivery networks, it's a costly undertaking just to launch and then to maintain. It's an ongoing cost, and you plan for that ROI, right? But if all of a sudden there are a bunch of really stringent guardrails in place, you're not going to see that ROI. So I think they're being cautious, and they just really need some sort of like certainty in the direction that the administration and Congress are heading in as far as establishing these guardrails. So they just want some certainty because it's expensive. And also, the EHRs are deploying tools within their offerings. So I think a lot of our members are taking use of that, which is great. But we are concerned about like that digital divide, the haves, the have-nots. You've got your under-resourced, and even the mid-sized hospitals are like, yeah, we just don't have the budget for any of that. So it's just kind of, do we need to maybe revisit amending regulations to Stark law and anti-kickback statute, the beneficiary inducement civil monetary penalty law, to kind of revamp it to include AI. So AI donations can be made by the haves to the have-nots, so we don't have that digital divide.
I was just talking about that, boy, I think 2 days, just yesterday, about actually the Stark laws. I mean, I don't want to, that's a long discussion, but literally we were working the Stark laws, I want to say in 06, 07, 08, when hospitals were going to help physicians pay for their EHRs, 08, 09, right on that time frame. So yeah, that's 15 years ago or so. But yeah, Great point to bring up. I mean, just for the sake of time, what else are you guys also researching outside of, say, cybersecurity and artificial intelligence, AI? Any other big regulatory topics or legislative topics you guys are navigating?
One thing that I would say, this is right now in the periphery, like our side, we're a small team, and we're scrappy, Justin.
Yes.
And it's cyber all day, every day, and AI. But
Okay.
something that has been a longstanding, passion project for CHIME is making sure that a patient can accurately be identified. And so we're focusing a little bit more just on what is going on in innovation from a digital identity standpoint.
Okay.
Now, digital identity is not, a full throttle solution necessarily for, at least in healthcare, for people who are, don't have a driver's license, like under 18. It's not for everyone, but it is something that is increasingly on our radar, and we're paying attention to it. NIST is doing some pilot projects. They're starting with the banking sector, which is great. They're further ahead than we are. But that's something that is on the periphery horizon that I'm focusing a little bit more. And then I also would say too, from a security standpoint, is single sign-on. We have so many problems with people trying to impersonate, a clinician, a staff member. We're going to, get into this a little bit more. We have a webinar coming up on this. But, these attacks on hospitals, like through the help desk, for example, the use of AI to generate like fake voices, it's even credentials. It's becoming, with each passing day, the level of sophistication is growing. And so it's like you're trying to stay like one head a step of the criminals, and it's really challenging in the healthcare space. I'll just say those two, though. I'll stop there.
Yeah, no, it's excellent. What would you add to that, Chelsea?
I would say privacy in general, like not just patient privacy, of course, but consumer privacy. If, my Apple Watch is, it does have like my heart rate and all those things on it. Maybe not always accurate, but it's, I don't want my data being sold to third parties. Then all of a sudden I'm seeing ads for things that are related to my healthcare. And so I think that's something Mari and I both feel fairly passionate and strongly about, is our data is our data.
Amen.
Trigger issue, Justin.
What's that?
Trigger issue.
Yeah, no, I'm with you. I mean, we all know we're in healthcare deeply, and we also know when you type something into your browser, it starts popping up ads. I mean, you already know we're already right on that wall. We certainly don't want our healthcare to spill over into that zone. So I'm grateful that you both are thinking about that. I'm not on Capitol Hill quite as much anymore, but I'm glad you two are. We're actually probably about a minute and a half left for this live show, but we'll have you guys back. You guys are wonderful. Got your hands in the middle of everything. But what's been about a minute? What's coming up, and what do we need to look out for? Maybe even later this year, or are we really 2025 or 2026? And hey guys, this is on the horizon. We've got it. This is coming at us like a bullet train. What are we going to look out for?
I'll start on the Hill stuff, and then maybe Chelsea, you can take the regulatory. On the Hill side, I would say it's funding the government, that little thing, right? A few days and counting, get the government funded, which honestly, between that and the election, like it doesn't leave a lot of oxygen left for much else. So funding. In terms of our priorities, we continue to really advocate for cyber funding. Other things too, just to wrap it up quickly, so Chelsea has a few seconds here, is the telehealth extension, which ends at the end of this year on the pandemic authorities, flexibilities.
Yes.
Chelsea already mentioned the national privacy law. That's not going to happen this year. And then our Match It Act, which is a patient matching bill that it's HR, I'm forgetting, I'll get the number, but there's 12 co-signers. It creates standards for patient matching. And that is something that we're utterly committed to. It's HR 7379. So that's the Hill quickly.
We're going to have a new administration regardless. Like it's going to be a new administration. And as you know, we're used to this here. We go through new administrations every 4 years or every 8 years. It's just kind of part of life here. So adapting, realizing what folks are going to stay, leave, and then getting to know new folks and establishing those relationships and, kind of waiting for the dust to settle like early spring. Usually it's March, April. We've got like a good idea of what's happening and made ourselves, ingrained.
Yeah. No, fantastic point. And I actually didn't think about that. I mean, obviously you see the political side, we know what's happening, but the shuffling that happens on Capitol Hill, it's right. I've been through 4 administration changes, my time on Capitol Hill. And yeah, I mean, sometimes it's similar faces and sometimes it's all brand new faces. However, you still kind of know there's a lot of shuffling, but you still know those people most of the time, at least half of them you've known because you've worked with, it's the same people, which just, it's when you've been on there for 20 years or so.
Some people go from private sector and they work in the administration. It's just
Exactly.
it's a lovely circle.
You got it. Well, Mari and Chelsea, you guys are phenomenal. Love the energy. I hope to see, will you guys be at Health? You guys both will be at Health, right? No Health this year? All right. Well, maybe Vive then, right? We'll see you at Vive. All right, there you go. Awesome. You guys are wonderful. Thank you so much. And thank you to everybody for joining us today. If you miss any of this broadcast, you can listen to us weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on LinkedIn at Justin T. Barnes and track me on Twitter at HIT Advisor. And use the hashtag ThisJustinRadios to respond to your comments from this show. If you missed any of this episode or want to hear more, all my shows are posted on Apple iTunes, SoundCloud, Spreaker, Spotify, iHeartRadio, and TuneIn. And check out the content we put out on justinbarnes.com on the new Thought Leadership page out there. Appreciate you guys again, Chelsea and Mari. You guys are wonderful. And I wish everybody have a great rest of your day. Thank you so much.